Good afternoon, friends. This is a talk on new dimensions in arthritis and avian management. Frozen shoulder, avian hip, autoimmune arthritis, rheumatoid disorders, hydrozone gaseous arthrodiastasis, and intra-articular injections are revolutionary for such conditions. This talk is going to focus on arthrodiastasis, major autohemotherapy, extracorporeal blood oxygen ozonization, and Mukharjee regime. 4 cases are shown and all the procedures are real time. I have added a commentary in the background for you to comprehend the procedural and technical methodology. X-rays are of long-term follow-up of patients with similar conditions and are not the X-rays of the same patients. Nevertheless, the immediate clinical results and the post-clinical pictorial representation are of the patients shown in the video. Molecular hydrogen is a sterile gas with great antioxidant properties and is an immune modulator at mitochondrial levels. Molecular ozone is sterilizing and oxidative gas with a great oxidant properties and is an immune modulator at subcellular level, mitochondrial level, DNA level, RNA level. Gaseous hydrogen and molecular ozone do not react with each other at room temperature and pressure and are extremely synergistic to each other. Gaseous arthrodiastasis is a process where we introduce these sterile gases into the joint to distract the joint and increase the joint space. MAHT is major autohemotherapy. EBOO is extracorporeal blood oxygen ozonization. The first patient has a frozen shoulder, a full thickness supraspinatus tear, 83-year-old, and has lot of pain. And the procedural video, including his follow-up on day 2 with the range of improvement, is shown in the video clips that follow this. Here is a gentleman who is 83 years old and he has a frozen shoulder on the left side. He is able to raise his right hand, but on the left side it is impossible to raise. You can see the amount of agony and pain in his face. MRI showed a complete tear of the supraspinatus tendon. He was advised arthroscopic repair. He had a traumatic tear because of a fall, but at this age there is enough degeneration. This is a three-way. When we are taking hydrogen gas, we have to ensure that it is non-escapable in a closed container. Now molecular hydrogen is being filled in a syringe. This is 99.9% hydrogen. which is sterile. I have found that there was some leak, so I have filled it again. The gas, hydrogen gas, must fill on its own without any pulling from our side. In case it is not coming fully, it means that the tubings are leaking somewhere. Immediately the syringe is inverted because hydrogen is lighter than the air and will escape. At this stage, a closed bivalve is attached so that the hydrogen does not escape. In the meanwhile, my assistant has extracted ozone 50 ml, 70 microgram per ml in another syringe. The two syringes are connected. This is the Chennai cocktail, where we mix 1 ml of 2% lignocaine with steroid and distilled water, alpha 1 spot in the first web space, and the remaining cocktail is given intra-articular. I do not use a C-arm and do it as an OPD procedure. Once the Chennai cocktail has been injected into the shoulder, we wait for a few moments for it to anesthetize. The entire video is shown real time without speeding up so that you can understand the procedure. You can see that the patient is pain free, comfortable and happy. Now we have to open up to ensure that we are able to push both hydrogen and ozone into the shoulder at the same time. The patient winces with pain as the shoulder joint opens up. Now we are taking 1 ml of heparin, that is 5000 international units, into a vacutainer bottle. We are pushing the heparin and it gets sucked automatically. We must pull it out with the needle, not empty the syringe alone. Another 1 ml of heparin, that is 5000 ml, is extracted in the syringe and is diluted in 5 ml of distilled water. This diluted heparin will be used for priming the MAHT set and also priming the butterfly, because in case we do not get a vein or have to change the vein, a primed butterfly is going to be non-coagulable. Butterfly which is primed is connected to the ozone compatible transfusion set. An ultraviolet irradiation chamber is hung on a drip stand. The UV lights are tested. It is positioned at a height. The IAOS vacutainer bottles are strong enough to ensure that the blood comes up against the gravity. Both the patient and the operators don UV glasses. A vein is identified and once it is punctured, we can open the blood set and the blood travels against gravity and enters into the bottle. We have to wait until 50 ml of blood enter the vacutainer bottle. IAOS vacutainer bottles are capable of extracting blood even using the thinnest of butterflies. The regulator is set at 1/8 of liter per minute. The switch used is number 2. The machine that is demonstrated here is IAOS Mark 5 machine. The syringe that is used is a polycarbonate 100% latex free silicone plunger syringe especially made for ozone activities. Once the quantity of ozone is connected, it is pushed into the bottle. The vacuum automatically draws the ozone inside, and the blood in the bottle, which was initially venous blood, now becomes cherry red and is ozonized. There is 100% absorption of ozone. This is a slow motion, and we show you how to turn the bottle and how to extract the syringe, which now leaves the needle in the bottle that acts as an air vent. There will be no air trap or escape through the bottle. The syringe is now unscrewed and taken away. The bottle is inserted into the special hanger, and the ultraviolet lights are turned on, and the transfusion set is opened to start the blood flow. This slow motion video section was required because many of our students had trouble in this step alone. So now the needle that is in the bottle is acting as an air vent, and this is gently placed into the UV container. The bent needle is slid to the side of the container so that the complete bottle is inside the container and that will be irradiated. We can see a small drop of air in the tube, and we can also see that the color of blood is now cherry red. Once the bottle is emptied, the drip set is taken out and the last of the blood is allowed to flow into the patient's body. As we have used heparin, we have to ensure that the bandaging is tight and an elastoplast bandage has to be used. If the patient accidentally removes the butterfly, there may be bleeding. The assistant who is applying the elastoplast is not wearing a glove because the elastoplast may stick to the glove. The patient is now asked to raise the hand immediately using a wooden step ladder frame for shoulder physiotherapy. Because of the gaseous arthrodiastasis, he is able to raise his hand up and down very comfortably. There he is attempting to raise his hand up and down, by wall crawling. We just need to advise and teach wall crawling for a single day, and thereafter the patient will develop full normal movements indistinguishable from the movements on the unaffected side. Here the patient is trying unassisted forward flexion, which is going to some extent, and later within 24 hours he sent me a video of him in his office chair, a very active gentleman who has regained full motions and is extremely happy at having avoided a rotator cuff surgery. Shoulder gaseous arthrodiastasis is an exceptionally good procedure for the next patient has polyarticular rheumatoid arthritis, extremely stiff shoulder, painful knee. For this patient, we did a hydrozone arthrodiastasis and a major autohemotherapy. The procedure of MAHT and injecting the shoulder and knee with hydrogen and ozone is shown in real time. Even full thickness supraspinatus stairs. Another rheumatoid lady who is not able to abduct her shoulder, has got severely painful knees, is being managed here. I am examining the other joints. Internal rotation of shoulder is extremely restricted. Abduction is extremely restricted. Whereas the other hand, the internal rotation is good enough. We are planning the same procedure of hydrozone arthrodiastasis of both shoulder and knee. We use ozone at 80 micrograms per ml and 50 ml of ozone are drawn in a syringe. Hydrogen at 99.9% purity and 600 ml per minute are used. We collect 50 to 60 microgram, 60 ml of 70 microgram ozone in the syringe. We have already collected hydrogen 20 ml, 99.9% hydrogen as shown for the previous patient. We take 1 to 1.5 ml of xylocaine, mix it with 40, which is with 20 milligram of methylprednisolone, acetonide, kinocort or depomedrol, and then dilute it with 16 ml of water so that we finally have a hexadiluted xylocaine with extremely low concentrations of long acting steroids which have been proven to be chondroprotective. We need 20 ml as we are going to inject 2 joints. Once this syringe is loaded, we change the needle. I prefer to do the shoulder first than the knee. We can see that we are in the joint and the cocktail goes in freely. I do not use a C-arm because I feel that it is a waste of valuable resources. We have injected first the hydrogen and then the ozone. The remaining cocktail is injected into the knee and we will see by the lack of resistance that we are in the knee joint. Thereafter, we again inject the cocktail of hydrogen and ozone into the knee. Ozone is first injected and then we can inject the hydrogen. The patient is encouraged to start moving the joints immediately. And now we prepare for major autohemotherapy. She has already started moving both the knee and shoulder rather instantly after the injections. We are injecting 1 ml, which is 5000 units of heparin in the bottle. Another 1 ml, which is 5000 units, is extracted, mixed and diluted with 5 ml of distilled water. This combination will be used to prime the blood transfusion set, which will be used for extracting and re-administering the MAHT. The transfusion set should not have a rubber. These are special polycarbonate sets made for IOS for ozone compatibility by a leading company. We must ensure that the interior of the bulb and the set is primed and the set is locked and closed. A 19 gauge or 20 gauge butterfly is now opened and this is also primed with the diluted lignocaine solution. Once both the sets are primed, one is attached to the other. A tourniquet is applied, the part is cleaned and the butterfly needle enters into the vein. The moment the vein is punctured, blood is seen in the tube. At this stage, we insert the point of the transfusion set and open it so that the blood flows and is sucked against gravity into the vacuotainer bottle. 1/8 of a liter flow at switch 2 from the IAOS machine provides 70 to 80 micrograms per milliliter of ozone gas, which is then going to be inserted or allowed to diffuse to the already collected blood. 50 ml of blood will get 4800 to 5000 micrograms of blood and thus 5000 micrograms will be diffused in 5 liters of human body's blood. A needle is bent at 90 degrees. It is pushed into the plus spot so that the ozone is sucked through the stainless steel filter. The moment the ozone is sucked, the bottle is upturned, the syringe is removed, the bottle is inserted into the hanger, ultraviolet lights are started, and the transfusion is commenced. We must be careful that the patient and the staff and operators wear IB goggles or UV protective goggles, or do not stare at the blue light. I and the patient are wearing the goggles. Once the blood transfusion is over, the drip set is removed from the bottle and the last of the blood is allowed to flow from the transfusion set into the patient's body. This is a closed vacuum system, no external interference, the whole set is sterile. You can see the big smile on the patient's face as the procedure is progressing. This young lady suffers from polyarticular rheumatoid arthritis, who had a very stiff shoulder not abductable beyond 50 degrees, extremely painful knees, and who had come walking to the clinic. Once the transfusion is over, we have to apply pads and bandages and ensure that the patient does not remove these for at least 4 hours, because heparinization may cause bleeding from the MAHT site if the bandage is removed, and the patient might panic. So a wad of cotton is put and we attach or we adhere, we paste 2 adhesive bandage strips on the injection site to make sure that there is no post-procedure accidental bleeding due to heparinization of the blood. We have also found that heparinization improves the dose delivery of medical drugs and low dose DMARDS, which are essential for treating rheumatoid arthritis, as well as this patient is now being asked to stamp her leg, and she is telling that she has absolutely no pain and she is very happy. She has got a big smile on her face, she is able to raise her hand up and she is absolutely pain free. The results seem miraculous, and that is the magic and miracle of modern molecular medicine. The next patient is suffering from rheumatoid disorder. The third patient has polyarticular rheumatoid arthritis, systemic lupus, bilateral hip avascular necrosis, and she is a medical doctor herself. This young lady doctor underwent a hydrozone hip arthrodiastasis along with major autoimmunotherapy, the steps of which are shown to you subsequently. Systemic lupus erythematosus, bilateral avascular necrosis of both hips. We have first closed a bivalve to ensure that no hydrogen escapes from the bivalve. From the hydrogen machine, 20 ml of hydrogen are extracted. The syringe is kept inverted so that the hydrogen doesn't escape, and the bivalve is tightened. From an ozone machine, 70 to 80 micrograms per milliliter of ozone are extracted. This is a 60 cc syringe and will accommodate up to 60 cc. Totally, we are having 60 ml of ozone and 20 ml of hydrogen. That is 80 ml. 40 ml of each shall be injected into either hip. So, 40 to the left and 40 to the right. This T attachment is made ready. Now, both hip joints in the groin area are cleaned. Anterior approach is the easiest for the hip joint. This is a mixture of a cocktail. We are taking 2 ml of 2% xylocaine or lidocaine. We are mixing it with 1 ml of methyl prednisolone acetonide or depomedrol or Kinocot. The ampule may contain up to 40 milligrams, but we are taking only 10 milligrams of the same. This is now diluted with 18 milliliters of distilled water, sterile distilled water, to make a total volume of 20 milliliters, and this shall be injected in both the hips, half for the left hip and half for the right hip. The key here is using diluted xylocaine or lignocaine, and that is the one that provides relief to the patient. We enter the hip, about half of the solution, which is 10 ml, is injected in the hip. The needle is retained in the joint. The hydrozone unit is now connected to the hip joint. The lower lock is locked. Hydrogen is first opened and 10 ml of hydrogen is injected into the joint. Hydrogen is closed, ozone is open and 10 ml of ozone is injected, 20 ml of ozone. Totally 40 ml has been injected into the left hip, and now the remaining cocktail is being injected into the opposite hip. And once the cocktail is injected, we again lock the lower lock syringe, and then the same procedure is repeated. Hydrogen is repeated, ozone is repeated, and we get a ligament gaseous arthrodiastasis. The pressure needed to open up the joint space, the patient will feel the joint is opening. This is not which clearly shows how the joint space opens when a gaseous arthrodiastasis is performed. This is my patient with a FICAD grade of 4, avascular necrosis post-COVID. You can see the magnified picture and you can see the extent of damage of the head. Fortunately, it had not yet collapsed. He had a hydrozone arthrodiastasis followed by Mukharjee regime for 18 months, and you can see how beautifully the hip has resolved and he is squatting, running normally. Another patient, you can see the series of X-rays, Ficard grade 4 on both sides, completely resolving with my video, as I do not do it under C-arm, but belongs to Dr. Jignesh Patel, this wonderful therapy. The last video is about extracorporeal blood oxygen ozonization. We first extract 1 milliliter or 1 cc of heparin 5000 international units. The same is pushed into the MAHT bottle of this lady. Sorry, this is not an EBOO, this is an MAHT, major autohemotherapy. Now, another 1 ml of heparin is extracted, diluted with 5 ml of distilled water. This volume will be used to prime the transfusion set, blood transfusion set, as well as the butterfly 19 gauge, which is going to be used for extracting the blood. We can see that the strip set is held high and the solution is used to prime the interior of the set, so that while we do the procedure, the blood does not clot. A butterfly is opened and the remaining heparin is used to prime the butterfly set. We may not exhaust the entire 5000 units. For 1 MAHT, the average usage is about 6 to 7000 units of heparin. The set is passed through a UVBI container. The patient is made to wear protective goggles. The vein is identified. This is a real-time video, so you can see all the steps in the right sequence. The left side, the vein was not good, so we shifted to the right side. The vein is approached. Then the drip set is inserted and the connector is opened to allow the blood to rise against the gravity and slowly fill up the bottle. We can see that the blood gushes in like a tap. A 60 ml syringe, 1/8 of a liter of oxygen inflow, total of about 5000 unit micrograms per ml or 5000 gamma of ozone per session, 80 micrograms per ml and around 60 ml of ozone oxygen mixture. Once the syringe is full, the needle is attached, is bent at right angles and is pushed into the plus sign of the bottle, which goes straight into the stainless steel diffuser. The blood gets sucked and bubbled into the bottle. The blood becomes tomato red from its venous purple. The bottle is inserted into the ultraviolet irradiator and the UV lamps are switched off. After the transfusion, we can extract the set out of the bottle and the entire amount of blood is allowed to be transfused so that no blood is wasted. This is a closed system. We do not dilute the blood with normal saline, we do not extract it with a syringe. This is a pure EBOO using borosilicate flint-free glasses and 100% ozone compatible material. So you can see the complete process to a conclusion. Once the blood has been drained, the butterfly is extracted, a tight padding is put, and we apply adhesive plaster with strict instructions to the patient that the plaster must not be removed for at least 4 hours, because we have used heparin. Accidental removal of this bandage will cause bleeding which might panic the patient. The next procedure video, that is the last case in this series, is the complete procedure of extracorporeal blood oxygen ozonization, EBOO. This is a rather complicated process. It cannot be performed in patients where we are not able to get a proper venous access. Patients with fragile veins, thin veins, very plump patients, very fat patients, we need to at least put an 18 gauge venflon, and unless we are able to put 18 gauge venflon, the patient may not be suitable or amenable for extracorporeal blood oxygen ozonization. Is being displayed is called extracorporeal blood oxygen ozonization, or EBOO. A heparin container is kept separately. Blood is drawn and is pushed up through a perfusion pump into the glass EBOO flask. This is a 100% borosilicate flint-free glass bottle with a stainless steel diffuser, which is the most ozone compatible system available in the world today. IAOS does not recommend the use of dialysis filters, especially cellulose triacetate filters, which we feel are a big scam. The blood now enters the glass bottle, and once the blood flow has begun, we can increase the flow rate and make sure that we get 40 to 50 ml per minute of blood flowing into the bottle. The recipient site is already ready. The blood from the donor site is entering, and through the perfusion pump goes into the bottle. Ozone is entering through the diffuser. You can see the blood being bubbled. To prevent excess pressure buildup in the ozone bottle, there is an exit tube from which the foam, froth and excess gas comes to a glass bottle. The UV lights have not been switched off. We are waiting till the bottle is 50% full. The tomato red color of the blood shows that it is being well ozonized. Once the blood is ozonized, the return set is attached. That is opened up to ensure that there are no air bubbles in the set. It is already heparinized blood, so the return set does not have to be primed. We open the tube, the blood is allowed to enter, 1 drop or 2 drops are allowed to enter the cup, then it is closed and attached to the recipient site. The donor and recipient speeds of transfusion are exactly matching, and as we are transfusing the patient's blood into him, there is no question of hemodynamic imbalance. As fast as the blood is being withdrawn, the blood can be retransfused into the body without any worry about volumetric disbalance. Depending upon the vein, the normal IAOS protocol is to use 50 ml of blood per minute. Once about 1.5 to 2 liters of blood are transfused, we can stop the system. This is showing how the blood is going into the perfusion pump. That is a heparin assembly, and there in blue color the ozone machine. Ozone is bubbling in the blood, and we have switched off the ozone machine for a moment to show you how the blood is cherry red. Ozone is the best known antibacterial, antiviral, antifungal, antiparasitic, and EBOO has been shown to reverse HIV infections. We can see the procedure, we can see the waste out, coming out on one side. We can see this is the blood going into the donor side, there is the blood coming out of the recipient side, blood coming out of the donor side going into the recipient side, and we can see the difference in colors, how the dark blood that is going into the bottle comes out cherry red and bright after ultraviolet irradiation and ozonization with 70 to 80 gamma or 70 to 80 microgram per ml of ozone diffusion. Because of our out tubes, there is no pressure buildup. This picture shows the color difference between the purple venous inflow and the cherry red outflow which is going into the body. In addition to being antimicrobial, antifungal, antiviral, antiparasitic, ozonized blood acts on mitochondrial level and is extremely useful for autoimmune conditions in a wide variety of ranges. Once the desired amount of blood has been filled, the tube is disconnected from the donor side of the patient. The perfusion pump speed is increased so that this entire blood enters into the ozone flask or EBOO bottle, which is the world's first non-hemodialysis filter, scientifically pure EBOO system. The entire blood which has been ozonated will be allowed to pass to the patient's body. Once the inflow terminus has reached into the bottle, the pipe is disconnected from the perfusion pump and the heparin part and the infusion part are extracted and taken away. We can see from the heparin bottle which is being removed that less than 150 cc of the solution has been used. So the total heparin used in this patient has not exceeded 9 to 10,000 units. We can see the blood red, tomato cherry blood red ozonize blood entering into the patient's recipient arm. The whole procedure has taken only 30 minutes and the patient is very comfortable. Once the entire amount of blood which has been extracorporeally oxygen ozonated is into the patient's body, the venflon is disconnected and capped. If we plan hydrogen and antioxidant infusions on the subsequent day, then we can retain the venflons in the body, and if we do not plan the same, we can remove the venflons. These 3 patient videos would have given you some idea about the actual mechanics and processes of the system. Here are some examples of now I am showing clinical results in a few herpes simplex cases with severe pain who are treated with sodium channel blocks and also MAHT. Herpes is a very simple infection and we do not need complicated methods like EBOO for them. They do very, very well with major autohemotherapy. These are the cases. MAHT curing fulminant herpes infection. These are not the patients who have been shown in this video, but you can see that within a day the herpes has practically disappeared. In a similar manner, the herpes is just about to appear, and post therapy in this particular patient we can see that the whole lesion has dried up. Thank you very much for listening to this talk. Thank you. If you want to learn these techniques, you can communicate with me by sending a message in WhatsApp. This is only for medical practitioners interested in molecular therapy. Do not make calls. Please send me a message. I will revert to you the moment I get time. Indian Academy of Orthopedic Surgeons, Global Academy of Molecular Therapists, and Ozone and Molecular Therapy Association of India in conjugation have a 5-month online course on molecular therapeutics for qualified medical practitioners. If you are interested in these therapies, feel free to send a message in WhatsApp. Thank you very much for your valuable time. Thank you.